This video has no sound. It's only the images projected on the screen.
Muy buenos días. Solo quiero probar que todos puedan escuchar,
I
¿sí?
just want to make sure that everybody's listening. Yes,
Excelente, gracias.
we are.
Bueno, buenos días.
Good morning.
Deseo extender una cálida
I
bienvenida
would like
a
to
los
give a
honorables
very
representantes
warm
de los
welcome to the
ministerios de
honorable
salud, a
representatives of the
miembros
Bom
Ministries of
dia,
Health,
comités nacionales
estendendo aqui
members
as
of
saudações a todos
International
os
Committee on
Ministérios de
Childhood Cancer,
Saúde, os
focal
pontos
points of the
focais
different PAHO
dos escritórios da
offices
OPS.
around the
Senhoras e
Americas and
senhores, meu
Caribbean.
nome é Maurício
My name is
Massa
Mauricio
e eu sou o
Massa.
assessor
I am the
regional de
Regional
prevenção e controle
Advisor
de
on
câncer e
Cancer
para
Prevention
mim
and Control.
é um
And for me,
grande
it is
prazer
a
estender as
pleasure
saudações da
to
equipe da
bring you
OPS
greetings
e
from the
de todos,
cancer team
todas as
working in the
agências
Americas.
equivalentes do
Thank you
Jude
so much for
Americas.
being here to attend
Muito
our
obrigada por
seminar.
sua
As you
participação
know,
nesse
this
seminário.
is
Como
Gold
sabem,
September,
estamos
which
celebrando o
is
Setembro
Childhood Cancer
Dourado
Awareness Month.
de
And
conscientização
we are
sobre o
very
câncer
excited about
pediátrico.
presenting
E
you
estamos
the
concentrando os
efforts
esforços na
done
implementação da iniciativa
regarding
global
the
da Organização Mundial da
implementation of the
Saúde sobre
mandates of the
câncer
World Health
infantil,
Organization, which
destinada
is
a
to reduce
reduzir a
the
carga
burden
de
of
câncer
child
infantil
childhood
e aumentar
cancer
a taxa
and
de
to improve
sobrevivência pelo menos
survival
até
at least to
60%
60,
para todas as
70%
crianças,
by 2030 for
sem
all the children
importar
wherever they are.
onde se encontrem.
Childhood
O
cancer
câncer
continues
infantil
to be one of the
continua a
main
ser uma das
causes of death
principais
among
causas de
children and
óbito
adolescents around the world,
de
and in the
crianças no mundo
Americas is the
inteiro.
second
E aqui
most
nas
important
Américas, a segunda
cause of
causa
mortality in this
principal
age group.
de óbitos
Each year,
anualmente.
it
Se
is
estima que
estimated that
30.000 crianças com
30,000
menos de
children
19
under 19
anos
years of
são
age
diagnosticados
are
com câncer e
diagnosed
a
with
taxa
cancer.
de
The survival
sobrevivência
rate
alcançou
is
55%,
55%, and
com
we have
significativas
significant
disparidades
disparities
nas
of the rates
taxas, nesses índices
registered in
entre
the different
países.
countries. And
Sabemos
we
que isso é
know
principalmente
that this is
causado,
unfortunately caused
por
by late
diagnósticos
diagnosis or incorrect
tardios,
diagnosis.
a taxas de
There are many
abandono, de
dropout
tratamento e
rates,
mortalidade
cases of
relacionada a
children that do
infecções
not receive
e
this
atenção
treatment.
oportuna de
And
qualidade.
through the
Através da
initiative
iniciativa do
Cure All
Cure
Americas,
Americas, a Organização
PAHO,
Pan-Americana da Saúde está
we are
implementando
implementing this
esta
initiative in
iniciativa em
19 countries
19
of the
países
region.
da região.
This
Esse
collective
esforço
effort
coletivo
is
está
increasing
aumentando a consciência
awareness at the regional level, and
nacional e
then the
regional da
prioritization of
priorização do câncer
childhood cancer,
infantil,
and also
estabelecendo as
setting
bases
the
para
basis to
resultados
find
positivos
better
para
and
as
more
crianças de todas
equitable
as
results for
Américas,
children and
com essa
adolescents.
oportunidade
And this gives us an
de
opportunity
envolver
to involve
todas
all the
as partes
stakeholders
interessadas.
and the key
Temos
actors at different
diferentes
global,
segmentos
regional,
globais,
and local
regionais.
levels. And
Queremos
we believe
reforçar
that
o
reinforcing
compromisso
the
de
commitment to
apoiar a
support
todos
all the
os países
countries
no
and
nível local
educating
para
all the
assegurar que
countries that we will be
poderemos
able to eliminate
eliminar
the barriers for
essa
the
barreira de
timely diagnosis
diagnósticos
and
e
strengthen health
para
services
que
to make
nenhuma
sure that no
criança
one is
fique
left
para
behind.
trás.
So for
E é
this
por
reason,
isso
we
temos
have
que
to think
pensar
of
em
how
como
to improve the
melhor dar
follow-up of the achievements
acompanhamento
that we have
e
attained, also
priorizando os
to make
registros
sure
nacionais de
that we have
câncer,
national cancer
aumentando
register, to
o
make
acesso
sure
a
that we have
medicamentos
more access
essenciais,
to
como
medicines,
podemos unir
and
todas
how
essas
to implement all of
iniciativas,
these initiatives.
onde
We have
muitos
advanced
avanços
a
já foram
lot,
feitos, mas
but this
não
would not
teria
be
sido
possible
possível
without the commitment
sem
and
a colaboração
collaboration
e a
that we
cooperação que
have
nós estamos
had, not
recebendo, não
only
só
at the
das organizações
international level,
internacionais, dos
the
ministérios de
ministers of
saúde, mas
health,
também
but
da
also
sociedade
civil
civil,
society foundations
fundações
in
nos
the
vários
different
países
countries
da
in our
nossa
region.
região. Na medida
As
que
we
vamos avançando
take this
juntos,
journey
temos que
together,
continuar
we have to
trabalhando para
work on the
conseguir essa
implementation of
missão
the
de
Cure All
cura e
initiative
salvar
and to
todas
make
as vidas,
sure
para
that
que as crianças das
children with
Américas
cancer in
recebam
the
os
Americas
estándares
have a
mais
high
altos
standard
de
of care.
atenção.
And as
Como
you see, we
sabem,
have many
neste
panelists
seminário
this year,
teremos
in this
vários
year's
panelistas e
webinar,
esperamos
and we hope
que
that the
essas
presentations will be of interest
apresentações
to you
sejam de
and
interesse
that they
e
will
que
lead to
possam
the
levar a
advancement
discussões para
and to
promover
make
a
sure that
importância
we
do
can work
trabalho em
together
conjunto para
in
realizar o
attaining
trabalho
the
em
goals
prol das
set in our
metas
region
estipuladas na nossa região
within the
dentro da
global
iniciativa global
initiative
de
for.
prevenção.
Nuevamente, muchas gracias por estar con nosotros.
Thank you
Muito
very much for
obrigado
being
por
here
sua
with us today.
presença
And now I
online
have
e deixo
a
agora
message from
com o
Dr. Carlos
Dr.
Rodriguez Galindo, who is
Galindo,
the
do
Executive Vice
St.
President
Jude
of St.
Research
Jude's Children
Hospital,
Research
Hospital de
Hospital.
Pesquisa St. Jude.
There's no sound.
Lamentavelmente, não temos áudio.
This video has no sound. It looks like the video has no sound. There's no audio.
Vamos a tratar una vez más.
We will
Muchas
go
gracias a
ahead.
todos los amigos de la
Thank you
Organización
so much to
Panamericana de la
all the
Salud
friends
por
of
el
the Pan
trabajo
American
tan
Health Organization
extraordinario
for the
que la
extraordinary
propia
work
OPS
that
y
you
sus
have
oficinas
conducted
nacionales en
from PAHO and the
colaboración con
national
los equipos de
offices in
gobierno,
collaboration
los
with
hospitales,
governments, hospitals,
asociaciones profesionales,
professional
los padres de
associations,
pacientes
groups of patients, parents of patients, and they are working for all the children and adolescents with cancer in the Americas. It is my pleasure to give you a warm welcome to this virtual seminar to celebrate Gold September, the Childhood Cancer Awareness Month. It is an honor and a joy to be able to share this day with all of you so that together we can reflect on the achievements attained through the initiative or eradication of childhood cancer in the Americas, which has been in place for 6 years. And we have in our hands the dreams of all of these populations, and we have to work together to make sure that we face the challenges that we will find and will be finding along the way. In the next few hours, we will be sharing the advances and strategies for early diagnosis, comprehensive management of childhood cancer, and then services appropriate for children and adolescents with cancer, and their inclusion in all the national plans, health plans of the Americas. From St. Jude, this is an honor. It has been an honor to work with PAHO teams and all the Ministry of Health, with all health professionals, the Association of Parents and Patients and Survivors of Childhood Cancer, and society at large, which supports them in all of the countries of Latin America and the Caribbean. As a collaborating center for WHO and for PAHO, St. Jude Global has helped to lead the implementation of the global initiative in the countries of Latin America and the Caribbean. And I am very pleased to be here with you today. Unfortunately, I cannot be here in person, only virtually. In the next few months, together with WHO, PAHO, and UNICEF, we will be launching a new platform for access for essential drugs for treatment of childhood cancer. This is a milestone in the journey that we have taken together, united under the same vision that we had at the beginning. And the progress in the fight against childhood cancer may lead to all the children in our region to be cured, whatever they may be. We can give them hope, and the best gift of all, the opportunity to live. So welcome again to this section for reflection and awareness. And again, my deep appreciation to the organizers at PAHO and to all the ministerial groups, health professionals for the important moments that they have given us in this important month, in such an important year as it is this in the life of each child. Today, we have an opportunity to continue to analyze the problems we face, to continue to reflect upon the achievements attained, and to make sure that we follow the lines of work for the future. I wish you a very fruitful session. Unfortunately, I will not be with you, but I hope that in the future I will be with you with you. My best greetings from St. Jude.
Excelente mensaje de Carlos,
excellent
como
message
siempre,
from Carlos,
y
as
hablando un poco
usually.
sobre la
And
plataforma
then talking
global de
about
acceso a
the
medicamentos,
platform
de
of
la
access
cual
to drugs,
países alrededor del mundo van a
countries around the world
poder acceder a
will be able
medicamentos.
to
Esto
access
va a beneficiar no solo
drugs,
el cáncer
and this
pediátrico,
will
sino que
only
también de
be
adultos.
beneficial
Igualmente,
not
esta
only to
región vamos a
childhood
escuchar
cancer,
un
but
poco
also
más
to
de eso
adult cancer in our
posteriormente.
region. And later on in the session,
Ahora,
we will be hearing
siguiendo con
about
la
this.
agenda,
Now, following the agenda,
vamos a
we
tener
will
el día
be
de hoy para ustedes un grupo de paneles. El
having
primero
a
va a
group
hablar
of
sobre el
panels.
contexto
The
actual
first
del
one
cáncer
will be
infantil en
about the current
América
causes of
Latina y el
childhood
Caribe.
cancer in Latin America and
Para
the
esto
Caribbean.
tenemos a la
And for
doctora
this,
Liliana
we have Dr.
Vázquez,
Liliana
doctora
Vázquez,
Soad Fuentes
Dr.
Alaví, a
Soad
Patricia
Fuentes Alaví,
Loreto, coordinadora de
Patricia
programas de
Loreto,
St. Jude,
coordinator of
como
programs
para
at St. Jude
compartir un
Global,
poco
and they
sobre
will
nuestra
share
situación actual.
with us what the present situation
gracias.
is. Thank you so much. Thank you so much, Dr. Maza. Welcome everybody to this seminar on Gold September Childhood Cancer Awareness Month. For us, it is a great honor and it is a deep emotion to be able to communicate with you. And as Carlos and Mauricio have said, we have a joint fight to improve childhood care for children that have cancer in Latin America and the Caribbean. So we will begin with this outlook on childhood cancer in the region, where we know that according to the last statistics, published by the research agency of the World Health Organization, the incidence of childhood cancer reaches 30,000 children, and we have 10,000 children that die, and 1 in 150 families will be affected in accordance with the statistic. So one of these 150 families will be affected. So we have to be aware of what childhood cancer is as a problem of public health, and it has to be, we have to give it visibility at the level of the governments, the health teams, foundations, academic sector, and in the communities. And then we have very important advancements and achievements that we have attained because we have invested in timely access and quality health care and integration of the health system, the improvement of referral services and the availability of essential services to treat children with cancer. We know they have to have chemotherapy, radiotherapy, surgery, among other treatments. So this is not equal at the level of the region. So evidently mortality is expected to be high in some countries as compared to what we see in different countries of the region. So this has a lot to do with several contributing factors. For instance, timely diagnosis, availability of treatments, and then the deaths that are preventable, among other causes. So these are all important points, and that is why today we have met to face this problem, to make sure that we strengthen the health systems in our countries, to be aware of the fact that we have to do more. It is possible to continue to work more so that children have a chance for cure. And this is evident in publications and in reports in the high-income countries. We see that 4 out of 5 children can be cured. But our region, the average survival rate is only 55%, as Dr. Massa said, and we hope that we can attain the target established, but 60% of survival by 2030. This is our global mandate, and this is an objective that we all have to work for. We have to work from the communities, from the side of the health professionals, from all the equipments that are accompanying and teams that are accompanying us today. So every child should have timely treatment, quality treatment. We have to improve their way of life. And then, as the mandate says, we have to decrease suffering, this burden that the family has, and to improve the quality of life of the patients. So this work and this initiative of control of childhood cancer has 4 pillars with the centers of excellence, universal coverage, treatments, evaluation and monitoring, and then facilitators such as advocacy, information, and others. So here is just a quick explanation of the theory of change, and it has to do with the advancement of the Cure All Americas initiative. This is a general outlook about the projects and interventions that we have at the national level. We have 19 participating countries. 9 projects have been in implementation. 3 are very active and completed. So we have 78 national projects and 72 that are gearing towards completion. So all of these interventions have demanded collaborative work in each one of the health teams under the leadership of the ministries of health, but also with the support of many stakeholders, doctors, foundations, scientific societies at the international, regional, and national level, the entire group of the civil society, and everybody that has a common purpose, which is to focus on the topics related to mortality that is totally preventable because of cancer. Likewise, there are some projects, as Carlos mentioned, at the regional level. We have the platform, global platform for drugs. Ecuador is one of the pilot projects. We have continued to advance on this implementation. And we also have a sub-regional focus, an approach for Central America, for the Dominican Republic and Haiti. All of this is important work that has been led by Comisca. And also at the sub-regional level, we have the implementation of the Andean roadmap, and we are prioritizing childhood cancer as a public health problem. And specifically, we have centered on how to advance in the improvements of the quality of care for the survivors of childhood cancer, timely diagnosis, palliative care, etc. Collectively, all of these points are important, and we are looking for specific items such as policies, laws, bills, guidelines that could be useful at the regional level. Next one, please. And now I'll give the floor to my colleague Soad. She will talk about a little bit more about this joint work. Thank you so much, Lily, for the work in which we have journeyed together. Within the products mentioned, we have been advances in public policies that require solid steps for implementation. And here we see how in 2017, only 6 countries have legislation, but then in 2023, these countries were increased to 13 in the region, and they have included the National Plan of Pediatric Cancer for the implementation of the Global Initiative Against Cancer in Childhood. In 2017, we had only 4 countries that were implementing national policies regarding the timely diagnosis, and then for 2023, we have seen an increase to 8. So the timely diagnosis is one of the points important in the treatment of the childhood cancer. For 2017, 4 countries were working in timely diagnosis. Now we see 8. And they are giving training, having early detection campaigns, healthy schools, in Honduras, for instance. And then other countries like El Salvador that had schools for the retinoblastoma detection, early detection of retinoblastoma. And then in 2017, we had only 4 countries that were implementing a regional diagnosis. So this will give us the guideline to go ahead. So for this, as Lily mentioned, we have worked at the sub-regional level, and remember that the global initiative can go from the global to the regional and to the national levels, and then vice versa. And then the national area can strengthen the sub-regional and the global areas to be able to improve care. And then Comisca created a regional strategy for the elimination of childhood cancer. We had a meeting in Costa Rica to evaluate the strategy up until 2030. And at the present time, we also have the work of CONAOR, and CONAOR has worked on this roadmap for the control of cancer in children and adolescents. Another important piece of work that we have conducted with a special regional group is the work with the survivors, with the objective of evaluating the present status of cancer survivals. And we have expanded our network. We have published questionnaires qualitative and quantitative. We have analyzed data, and in the regional meeting in Guadalajara, we presented the results of several surveys, and we have been working with CCI, with St. Jude, with SIOP, and San Juan de Dios, and PAHO, and then with Faros de Vida Latin Network. And then now we have expanded our activities to 16 countries with 180 active members. We have had an increment of 213% in our activities. So also we have several materials and technical materials that are targeting not only the health professionals, but also the community. You can scan in the QR code here all of these documents in the virtual campus library of PAHO, and we see work in El Salvador, in Mexico, in all of these countries that are implemented initiatives for timely diagnosis. We have country profiles, a situational analysis, and technical documents such as guidelines for nutrition, nursing, etc. And also, we have materials targeting the community, for instance, the map of Emily, and then social standards for the prevention of treatment of patients with retinoblastoma and sarcoma. Next one, please. Now, I will give the floor to Patty to talk about the results that have been implemented in matters of diagnosis, quality, and the improvement of the response to childhood cancer in the systems of Latin America and the Caribbean. Thank you so much, Soad, for sharing this, the details of our work. We have several results that we had in Peru, Ecuador, Argentina, regarding the reduction of the late diagnosis, the reduction of dropout rates, and other matters. Regarding training, for the health professionals, we have virtual courses from PAHO in early diagnosis and palliative care. And we know that there are more than 180,000 people who have been trained in the different countries, and this was expanded beyond our region. And then we have conducted this in 126 countries around the world. And we hope that we can continue to train professionals. And then, of course, we are very interested in the user satisfaction, which is 97%. And then now we have some information about the alarm signs for childhood cancer that were launched. We launched different materials, videos, publications in different languages, in original languages, to make sure that we reach vulnerable, most vulnerable populations. And then, of course, we have lots of visits here. In terms of influence, how can we communicate and promote what we have been doing about this change? We want to take this beyond the organizations that are participating in the different organizations. What is the impact of all of this? So we have several dissemination channels. We have a monthly bulletin in different languages, podcasts. We also have resources there. The resources mentioned up to now. We have several monthly meetings in the different countries that are part of the implementation of this initiative, webinars. For instance, the webinar that we're having today. And then also we had posters, and we have posters in the different countries that were developed to record achievements and progress and the lessons learned.
Last year, we launched a childhood cancer supplement, which covered many different topics. It was launched in the Latin American Public Health newsletter, and it covers global issues, trends, incidents, impact of the initiative, And one thing I like very much is it also covers country experiences. Teams sent in their articles and they were included here so we can learn how the teams organize themselves, how they worked, and the impact they had through their work and initiatives to improve the status of childhood cancers. And there are many other topics. If you're interested, we invite you to use the QR code so that you can learn more about these articles. And then finally, impact. We have a target for 2030, as Lily said, and these are what I would call more specific targets. We have the overall rate, survival improvement, which is a target, but we also want to see more countries with national childhood cancer policies or strategies. We hope that we will have 25 countries with such policies in the region by 2030. We'd also like to see more countries implementing strategies aligned with Cure-All. As we said, we currently have 9 countries in implementation and are working to get more countries on board with these activities. Many are in the planning stage, and we need to continue working with them collaboratively so that they can finalize their efforts and implement them. And then lastly, the monitoring indicator, which is the number of documents that are being prepared. Liliana spoke about this before. We're aiming to have these for all regional projects in Spanish, English, and Portuguese so that we can disseminate them in the region. So it's a widespread regional movement to address childhood cancer. You can see some of the teams here, but there are more, and we're all working together as part of this regional effort. In conclusion, I wanted to say a few thank yous to all patients and their families, to all the health teams. For each of these projects, there are many people behind the scenes, and I cannot mention them all. So thank you for your efforts, for your dedication in addressing different challenges and realities. Thank you to the ministries and their staff. Their support is essential to get all this done. Also the PAHO country offices, the technical teams, the regional committee members, academia and scientific societies that are working with us on these projects, and also organizations of parents and foundations, essential partners in this endeavor. So that is all. Thank you to everyone, and we will continue working so that no one is left behind. Thank you.
Muchas gracias.
Thank you very much. I too would express my gratitude because, as you said, there's so many people working together to make this a reality. There are two things I'd like to highlight. One, it's amazing to see how much progress has been made, everything that has been done thanks to the initiative. And the other point is how we're going to measure the impact of everything we're doing at the regional level. So thank you so much for sharing this with us. We'll move on to the next panel. And the makeup of these panels gives you an idea of how we need to bring in different players to achieve our objective. We will have Andrea Chacon from the Ministry of Health in El Salvador, Vivian Perez, who represents the PAHO office in Mexico, Renata Couto, who's the executive director of Desiderata Foundation in Brazil, and Luis Bengoria, who coordinates the cancer initiatives with the Ministry of Health of Argentina. So we have many different offices working together, the ministries, PAHO, civil society, sub-regional organizations. All of these work together to make these initiatives possible in different ways. So I leave you with the next panel, which is Advances in Strategies for Early Diagnosis of Childhood Cancer, and with Dr. Andrea Chacon. Good morning. It's a pleasure to be with you from El Salvador. As part of this Gold September, it's an honor to present the advances achieved as part of the global initiative against childhood cancer. Next. As Ministry of Health, we have institutional regulations which provide us with a foundation for all these international strategies. For example, we have health priority number 4, which calls us to reduce mortality, cancer mortality, and non-communicable diseases in general, and this includes childhood cancers. Also, we have a national plan for the integrated treatment of cancer in children and adolescents, and these are the standards that underpin the initiative and our work with Cure-All. Under the Excellence Center pillar, we support the entire strategy and undertake interventions at all levels of the ministry. We have included in our national plan elements like comprehensive care and also a human rights approach to provide full coverage for children and adolescents. This also has led to greater efforts in early diagnosis of cancer in the child population. If we look at objective number 2 of the national plan, which I just referenced, it's to develop and integrate interventions for early detection of cancer in children and adolescents through the national integrated healthcare system. So this means that we first had to take stock of what we had done as a country. We had strengthened our installed capacity, and this means infrastructure, supplies, drugs, and teams, equipment, and very importantly, training of our human resources in order to define the lines of action to be followed, and also to improve our knowledge of childhood cancers to be able to detect early signs and symptoms of childhood and adolescent cancer, thereby triggering timely referrals. Last year, we launched the strategy for training in early diagnosis and referral for children and adolescents with cancer. And we set up a course which has 2 components. One is in person, the other is remote. For the in-person course, we hold classes in person. We review elements about the main types of cancer in the country. We review and explain the signs and symptoms which can lead to a cancer diagnosis, cancers like lymphoma, leukemia, among others. And during the first course, we certified 61 multidisciplinary healthcare professionals. And they are now our experts. They become contact points for further training, and they help us to identify early signs of cancer. And the idea is to improve the treatment for these children and also improve their survival rate. For the virtual component of the course, we use the PAHO platform and its early diagnosis in children and adolescents. That is the title. And we scheduled periodic meetings to answer questions and to get comments from our participants. This is done in coordination with pediatric oncologists at our Center of Excellence and with the help of the foundation. The participants have to complete the course and complete an evaluation in order to receive their certificate. Next slide, please. This year, 2 days ago, on the 25th of September, we held the second part of the strategy and certified, or will be certifying 100 additional multidisciplinary healthcare professionals specializing in cancer diagnosis in children and adolescents. They too will become experts in detecting early signs of childhood cancer. And we've done all of this together and in coordination with the Ministry of Health, with the local PAHO WHO office, with the support of the regional office, and also working with the foundation and the ministry's team of experts, which you can see here in the photograph. There's the medical center and the Ayúdame a Vivir Foundation. It's the Benjamin Bloom National Children's Hospital. We will have certified 100 more individuals, professionals who will now support us to improve the early detection of cancer in children with suspicious signs or symptoms. And then the next thing I'd like to mention is that we have strengthened our installed capacity and our human resources. These are very valuable assets because they are the ones who can trigger warning signs. And we are developing a document which will be a guide, a reference guide for early diagnosis and referral. It will be a roadmap for detection of cancer and early referral or timely referral of cases of cancer in children and adolescents. So there's a bibliography. There are PAHO and WHO reference documents. And this document, we believe, was developed in Argentina. It covers children, adolescents, support programs, and this was done with the country office in El Salvador and with the support of the National Cancer Institute of Argentina. We have taken very useful elements from these documents, adapted them to our own reality, and will put them to use to make sure that we meet the objectives of the Global Childhood Cancer Initiative, and will also be able to complete the work as a center of excellence and also follow the guidelines for advocacy and leadership by using our institutional regulations in pursuit of this objective. So thank you very much for all the support we have received from PAHO, also locally, regionally, and also for the IU Hospital and all those who have supported our efforts, which are so important to have early diagnosis and timely referral for our children. We know that all of these strategies are extremely valuable, and as a country, we have worked hard to increase survival to 71% survival rate. So thank you very much. And this is what we wanted to share with you from El Salvador. Thank you. Thank you very much, Doctor. I don't know if Luis, are you with us? Are you having any technical issues? I am ready. Thank you very much, Luis. Please go ahead. I'd like to start by extending very warm greetings from the Andean Committee on behalf of Dr. Davilas, who's the executive secretary. She tasked me with sharing with you her personal commitment as executive secretary and also as a pediatrician with the frontal fight to reduce all the risks surrounding childhood cancer. Please go ahead. The next slide. In our region, childhood cancer is one of the main causes of death during childhood and adolescence, even though in 1990 we had high indicators and they have come down. We have not seen a sustainable trend, downward trend. So we have indicators for the 6 Andean countries of 5.3 deaths per 100,000. And yet, I should stress that within our 6 Andean countries, namely Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela, we find mortality rate indicators of 6.8 per 100,000 and also below 3% as the outliers. So this means that there are rate differences when it comes to childhood cancers within our group of countries and within our individual countries. The risks surrounding this disease in children are late diagnosis, inadequate access to treatment, dropout from treatment, health inequalities, and there's also extreme indicators like treatment time of 3 days for leukemia in some countries, whereas in other countries, the treatment takes 50 days. Also, the time for diagnosis of leukemia takes 7 days in one country, whereas in another country it could be 107 days. So this points to the need to have a commitment to undertake a collaborative effort, to pool our efforts as we address this problem. So the pandemic marked a before and after, because as you know, the countries of South America were the epicenter starting in 2020 and up to 2021 for the presence of the pandemic and its impact on individuals with comorbidity, including cancer patients. And that is why we decided to do 3 things at the outset. The first was to look at the health status of cancer and how it was impacted by the pandemic, and we did that. The second was to prepare an Andean childhood cancer policy. Could we go back to the previous slide? Thank you. The Andean childhood cancer policy, and thirdly, to draft a plan. The partnership set up in 2021 with PAHO, the Andean Health Organization, and also direct work with Dr. Liliana Vázquez and María del Carmen Uyapalma, identified the need to have a regulation adopted by all countries, and that is what led to the special meeting of ministers in 2023, where the Andean roadmap to improve cancer, the approach to cancer was adopted. So this is the second instrument, the second tool, and it set up a series of goals and also set up a specialized group on childhood cancer, which were part of the Andean Cancer Committee, which had been established back in 2022. And the third tool is that our plan, a strategic plan for 2030, includes childhood cancer as one of its objectives. So we already have three very powerful instruments which provide governance and leadership for work in the Andean countries in this connection. So as part of this framework, we have the Andean policy right here at the center. Our roadmap is the programmatic framework developed by all the partners, PAHO, St. Jude's Hospital, the Andean Health Organization, and most importantly, the ministries of health working through their specialized centers on childhood cancer. And the other extremely important point was follow-up of all the actions in the cooperation projects to address health issues. In this case, the CCHV agreement with PAHO, which provided us with the tools we needed and with a seed fund with resources to speed up execution and implementation of the roadmap. Next. Now, what was done with this joint effort? I would say that collaboration has facilitated effective integration of efforts among Andean countries, also with supporting organizations and others who have been part of our approach to reduce the risk of childhood cancer and also provide us with means to advance towards our goal of increasing survival rates for children with cancer. Also, having identified problems with knowledge at the first level of care, the primary level, that was another very important thing we did, and it was done horizontally at all levels in countries, especially those that countries had designated as top priorities. As part of that joint work, there was one great advantage, and it was that we were able to make progress with early diagnosis of childhood cancers. There's also quantitative achievements and qualitative achievements. So at the primary level of care, we have been able to work with many professionals and train many community members as well. And we're still working to determine the real scope, the real extent of childhood cancers in our country. As Dr. Mauricio said, we need to continue measuring impact, and I think it is extremely important to know to what extent we have been able to close the gap. I believe that it's essential for us to work on improving early diagnosis of cancer and also to share what we learn with other countries, to share information. Countries that are more developed are working with other countries in an approach that is based on solidarity. You may ask, how do we do this? One important means is a chat, which includes all the members of the Cancer and Childhood Cancer Committee. That has been invaluable for us to exchange information and knowledge, also to share opinions, and also to communicate information about the work we do. We meet every 15 days, and we can have a conversation and gauge the progress we are making, try to assess the gap, also effectiveness, see how we can share know-how, and also information about the progress made in each of the countries. And PAHO and PAHO-san are also part of this chat, also the Andean Health Organization, the Ministry of Health and its technical teams. Also, as I said before, PAHO and the focal points in each of the PAHO member countries. So we have ongoing communication because we have this instrument, this management tool, and I think that is extremely important. And finally, we hope to be able to close the gaps as soon as possible. Another important step for us, for the Andean Health Organization and our public health issues, was the framework agreement with PAHO through its highest authority, Dr. Yarbas Barbosa and Dr. Maria del Carmen Ocalle, reaffirming these commitments for future cooperation. I would say that these partnerships are essential, and the Working Group on Cancer and Childhood Cancer are an example of this. Finally, we have a motto, which is a very special motto. We have all used it at different junctures when we are working together or separately, and it is together we are stronger, and together we will go further. Thank you very much.
Muchísimas gracias, doctor, por esa
Thank you very
excelente
much
ponencia.
for that
Y
excellent
bueno, quería
presentation.
solo decir, no lo
I
mencioné, pero
just
la
wanted to
doctora
say something
Chacón
I did
de
not
su
mention
charla dijo
before, but Dr.
algo
Chacon,
muy interesante que
in her
fue
presentation, did
que
say
hay
something
que
quite
darle vida a la
interesting.
iniciativa.
She said we
Y
need
lo que
to
tomo de
infuse
esta
life into the
ponencia
initiative.
es
And what
la
I take away
importancia
from
de
your presentation is
visibilizar el cáncer
how
infantil
important it
y
is
actuar
to
al respecto.
make childhood cancer
Antes de la
visible
iniciativa,
and to
cuando
take
nosotros
action.
recibíamos
Before the initiative,
solicitudes de
when we
apoyo para el
receive
tema de
requests for
cáncer, muchas
support
veces
in the
no
area
nos
of
incluye el
cancer,
cáncer infantil como uno de los que
childhood
tenemos que
cancer
priorizar.
was
Y
often
poder
not
ver ahora
included
esta
among the
hoja de
priorities.
ruta
And
para
now,
toda una
seeing
subregión
this
es algo
roadmap for an
increíble y
entire
gracias al
sub-region is
apoyo de
fantastic.
todas las
And it was
gestiones
achieved thanks
que se
to
hacen por el
all the
grupo. Entonces,
support
nuevamente, muchas gracias por eso.
received from
Y
the
ahora, a
group. So
continuación,
again, thank you for that.
nuestra colega de OPS, la
Next, we
doctora
have our
Vivian
colleague from
Pérez,
PAHO,
la
Dr.
asesora de enfermedades
Vivian
no
Pérez.
transmisibles
She's
de
an
la OPS en
advisor
México.
on
Nos va a
non-communicable
hablar un poco
diseases,
sobre el avance
and she's at the
estrategia de
Mexico
diagnóstico
office.
precoz.
She's going to speak about
Sí,
the
muchas gracias,
early
Mauricio. De
diagnosis
verdad que
strategy.
es un honor para
Thank you,
nosotros estar
Mauricio.
en
It's
estas
truly a
actividades por
pleasure
el
for us
septiembre
to be a
dorado
part of
y
this
presentarles un
Gold
poco la
September
experiencia que aquí en
activity
México
and to
en el
share Mexico's
fortalecimiento de las
experience in
competencias
strengthening
personal de salud
health
para la
care
detención
personnel
temprana a partir de
competencies
la
in
construcción,
the
¿no?,
area
de
of detection. And
curso
this was
virtual.
done through a
Entonces,
virtual
como conocen y
course.
bueno, lo refirieron
As
al
you may
principio,
know, and it
México
was
también
mentioned
es
at the
uno de los
beginning,
países que
Mexico
reporta
is
todavía
also
una
one of
alta
the countries
mortalidad
still
por cáncer en
reporting
la
a
infancia, en la
high
infancia y en
rate
la
of
adolescencia.
mortality for
Y
childhood
el cáncer
and adolescent
representa en
cancer.
México
In
aún la
Mexico,
tercera causa
cancer
de muerte
still
en el grupo
is the
entre 1 y
third
4
cause of
años.
death
La
for the
segunda
age
causa de
between the ages
mortalidad
of 1
también
and
para el
4.
grupo etario
It's
entre
also the
5 y
main cause of
14 y la
mortality for
cuarta
children from
causa
5
de
to
muerte
14, and the
ya en el
fourth
grupo
cause of
de
death
niños y
for the group
adolescentes
of children
entre
and
15 y
adolescents
24
between
años. No
15
obstante,
and
México
24 years of
desde a
age. And
nivel
yet,
constitucional
Mexico,
establece, ¿no?, ese derecho que
Mexico's
tienen todas las
constitution
personas a
establishes the
tener la
right
protección
by
de su
all
salud. También
individuals
se cuenta
to
con
have
una
protection
ley
for
para
their
la
health. There's
detención
also
temprana
a
y
law
también
on
cuenta con un
early
programa de
detection,
cáncer
and there's
para la
also
niñez y la
a
adolescencia.
childhood and
Y en este
adolescents
marco,
cancer health program.
recientemente, el año
And
pasado,
against
también
this backdrop,
lanzaron unos
last year, they
lineamientos
also
operativos que
launched
permitían
operational
y
guidelines that
encaminados
made it possible
específicamente a
to
lograr esa detención temprana,
improve
referencia oportuna
early
y de mejoras
detection
que
and
permitan
timely
el
referral,
diagnóstico
as
y
well
la
as
mejora
other
de la calidad de la
enhancements to
atención
improve
y de esa manera
diagnosis and
garantizar
quality of
la
care,
sobrevida
thereby
de los
guaranteeing
niños y
survival
niñas y
of
adolescentes
children,
con cáncer.
boys and
En
girls,
el marco,
and
¿no?, México
adolescents
también
with
se une a la
cancer.
iniciativa y a la
Mexico is also part
participación
of the initiative,
de
and our
OPS
office,
México
our PAHO
junto
office in
con las autoridades
Mexico,
de la Secretaría de
jointly
Salud y en
with the
especial con
authorities
el
in the
Centro
Ministry of Health and especially
Nacional
with
para la Salud
the
de la
National
Infancia y la
Center
Adolescencia,
for the
CENSIA,
Health of
donde establecimos
Children
unos
and
objetivos
Adolescents,
común. En el
CECIA,
marco de esa cooperación
have worked as part of a technical cooperation initiative. We have supported a country with improving the record for cancer cases in children and adolescents, and also improving the collection of validated information. It also is helping the country develop a guide for early detection and appropriate and timely referral of cancers in children and adolescents. It's aligned with the original guideline.
Also, we have been working in technical cooperation to be able to train and strengthen the competencies of health personnel at the first contact. And also, we have launched a virtual course on early detection. This virtual course on early detection is similar, or actually, let's put it this way, this is a regional course that we have adapted to the context of Mexico to make sure that the country has a national guideline, and we have this course that is inserted with the virtual campus of public health at PAHO. And then we have included the objectives of strengthening the health personnel capabilities at the first contact in recognition of the symptoms and suspicions of cancer. And then, of course, to widen coverage structured in 10 modules and in different resources for self-learning, and this is all free. And also this has been an enriching experience because it offers a variety of resources and also information about clinical cases to strengthen the knowledge, especially the practical knowledge of health personnel. So all of these modules have been structured as it appears here on the screen: primary, secondary, and tertiary prevention, cancer care, topics related to the application of a special system that we have to detect symptoms and signs of cancer, and other things that are actually linked to specific types of cancer, and to make sure that we can take care of oncological emergencies. All of these modules could last from 30 minutes to 1 hour. And this will guarantee the improvement of coverage for early detection. As you can see here, this is an information that we can actually download from the virtual campus site. We have 4,269 people registered for the courses, and we have issued 2,854 certificates. And this is a course that was adapted to the national guidelines of Mexico during childhood and adolescence cancer. We have had the participation of several people who have been already certified, and actually the course has already gone beyond our borders, and there are some countries that are already interested in this particular certificate. Next one, please. Out of the 2,854 certificates that were issued, 67% of the people who registered, and this is the largest number of certificates issued to participants, we see that 85% of these people come from the first level of care centers, and there is a marked participation of nursing personnel. So this is a wide-ranging approach, and this course was launched on February 15th, which is the International Day for Childhood Cancer in Mexico, and then we have wide-ranging participation and a lot of certificates and a lot of expressions of interest. I would like to invite all of you to take this course. We believe this is a key element for the survival of the child and adolescent population in Mexico so that we have timely detection, timely diagnosis to make sure that we attain survival. Thank you.
Vivian, en realidad para mí era
Yes,
nueva esta
for me,
actualización de
this
cuántos
is
y qué
something
felicidad
really new.
me da ver que
I am
van
so
casi
happy
3,000 personas
to
ya
see that
están
almost
certificados.
3,000
Esto
people have
resalta el
certificates.
compromiso
This shows
que
the
tienen
great
ustedes en México
commitment
para
that you have in
apoyar
Mexico
esto y
to
cómo
support this
podemos utilizar el campus
and how
virtual
we can use the
para
virtual
genuinamente
campus
extender y
to
crecer el
expand
conocimiento de los
and
proveedores de
to make
salud, no solo en
sure
México,
that
sino que
knowledge
también
is
en toda la
disseminated not
región.
only to health
Muchas
personnel, but
gracias,
also to
Vivian.
the entire region. Thank you so
Y
much.
para cerrar este
And now,
panel,
to close this panel,
tenemos a Renata
we
Coto,
have
que
Renata
sabemos que es
Cuoto.
la directora
She's the
ejecutiva
executive director
de Desiderata en Brasil.
of the
Es un
Desiderata
gusto
Foundation in
tenerla
Brazil.
con
It
nosotros
is a
el día
pleasure
de hoy
to
para
have
que
Renata with
hable de
us
la experiencia de
to talk
diagnóstico
about
precoz en su
her
país.
experience about early diagnosis in Brazil.
Muchas gracias por
Thank you
la
so much
invitación.
for the
Yo
invitation.
voy a hablar en portugués porque
I
mi
will be
español
speaking
no es
in
tan
Portuguese
bueno.
because my Spanish is not so
Pero
good.
bueno, pero no te preocupes.
Don't worry about it.
É um prazer enorme estar aqui com todos vocês, todos e todas vocês que estão nos assistindo. Queria muito parabenizar a iniciativa e da atuação da OPAS e do San Jude na conscientização sobre o diagnóstico precoce, sobre o câncer infanto-juvenil e, sobretudo, para reduzir, não só na conscientização, mas a atuação para reduzir o seu impacto em crianças e adolescentes e também nas suas famílias, né? Porque nós sabemos que o câncer tem um custo emocional muito grande. Podemos passar, por favor. Então, para quem ainda não conhece, o Desiderata é um instituto de fortalecimento de políticas públicas de saúde. Nós atuamos no Brasil há 21 anos. Pode passar. E podemos passar também. E a gente escolheu trabalhar com o Sistema Universal de Saúde. Então, no Brasil temos um Sistema Universal de Saúde que hoje é o principal caminho de cuidado para 78% da população brasileira, incluindo crianças e adolescentes. Então, nós escolhemos, o nosso foco de trabalho é o fortalecimento das políticas públicas e do Sistema Único de Saúde, porque é a forma da gente conseguir chegar em toda criança e todo adolescente no Brasil. Nós trabalhamos já há 21 anos com foco no controle do câncer e, mais recentemente, nós trouxemos também a agenda da obesidade infanto-juvenil. Juntas, essas duas agendas são ameaças muito importantes para a saúde de crianças e adolescentes no Brasil. Como nós sabemos, o câncer é a principal causa de morte por doença no Brasil entre pessoas de 1 a 19 anos. E a obesidade é uma pandemia no mundo e, infelizmente, no Brasil também. Nós acompanhamos que entre 3 crianças, pelo menos uma criança brasileira tem sobrepeso ou obesidade, e isso tem impacto na sua saúde e também no seu desenvolvimento integral. E é a partir da nossa experiência de mais de 20 anos de atuação no câncer infanto-juvenil que eu venho partilhar com vocês a nossa experiência do Unidos pela Cura. Bom, esses aqui são alguns dados sobre o câncer no Brasil. Então, nós estimamos que são por volta de 8.000 casos por ano. Isso, em termos de saúde pública, não é um número grande, é considerada uma doença rara, mas, apesar de rara, é uma doença que ela evolui muito rapidamente, né? Em crianças e, diferentemente dos adultos, não existe uma prevenção. Em compensação, se a gente conseguir fazer o diagnóstico precoce, a gente consegue alcançar até 80% de chances de cura. E, infelizmente, a gente está muito longe desse cenário. No Brasil, a taxa de mortalidade por câncer infanto-juvenil ela está estagnada há 20 anos. o que não é explicável, porque nós temos um sistema único de saúde, nós temos recursos para tratamento e são números limitados de casos. Então, a gente já poderia ter superado esse assunto, mas, ao contrário, a gente não consegue evoluir nem reverter esse cenário. Então, a atuação do Desiderata é, primeiramente, fazer advocacy por essa agenda do câncer infanto-juvenil. A gente precisa alcançar mais relevância nessa agenda. Unidos pela Cura começou a ser desenvolvido em 2005 no Rio de Janeiro e ele foi desenvolvido de uma forma coletiva. Então, basicamente, a gente convidou para a mesma mesa gestores de saúde, especialistas, profissionais de saúde e outras organizações da sociedade civil envolvidas na agenda e juntos nós desenhamos uma estratégia de promoção do diagnóstico precoce. Com os resultados alcançados, Unidos pela Cura foi integralizado no Plano Estadual de Saúde do Rio de Janeiro, se tornando uma política pública. Então, antes do Unidos pela Cura, o tempo entre a suspeição e o diagnóstico final do câncer no Rio de Janeiro era de aproximadamente 60 dias, e depois da implementação do Unidos pela Cura, esse tempo se reduziu para 3 dias úteis. E como isso aconteceu? Basicamente, nós focamos na atenção primária, o que não é óbvio, porque quando nós pensamos em câncer, geralmente nós associamos a tratamento e a alta e média complexidade. Mas a nossa aposta foi, entendo a linha de frente, já que a atenção primária é a porta de entrada das crianças e suas famílias no SUS, no Sistema Único de Saúde, se nós tivéssemos essa linha de frente sensibilizada e preparada para a realização do diagnóstico, nós ganharíamos muito tempo. E foi isso que aconteceu. Em 2021, nós lançamos um panorama nacional do oncológico pediátrico. E esse panorama nos revelou as distorções em termos de acesso a diagnóstico e tratamento no Brasil. O Brasil é um país muito extenso e muito complexo, então nós temos muitos países dentro de um país e em algumas regiões as diferenças em termos de acesso diagnóstico e de sobrevida é muito grande. E esse panorama apontou a região norte e nordeste como as mais críticas. Então, a gente já estava completando bastante tempo, né, nessa metodologia que a gente estava aplicando já no Rio de Janeiro, já com bastante refinamento, e nos deu essa vontade de apoiar outras regiões no Brasil e pensamos em Pernambuco. Pernambuco está na região Nordeste e apresenta alguns critérios, né, para a nossa escolha. Uma é que realmente ela consegue reunir números de casos significativos por ano e também uma cobertura da atenção primária robusta. A atenção primária é a nossa matéria de trabalho, então é muito importante olhar para essa rede. E por uma confluência também de interesses, ao mesmo tempo nós estávamos olhando para Pernambuco, juntamente com o Jude, com a OPAS e com a iniciativa global. Então, foi uma oportunidade de nós juntarmos forças e irmos juntos para esse território. Nós realizamos um diagnóstico que levantou muitas iniciativas bastante consistentes, voltadas já para o câncer infanto-juvenil. Então, a implementação dessa iniciativa de diagnóstico precoce em Pernambuco tem sido uma experiência muito distinta no Rio de Janeiro. Isso porque também no Rio de Janeiro, na época que nós implementamos, o SUS ainda estava também sendo implementado ao mesmo tempo e não existiam tantas iniciativas. Então, o nosso trabalho hoje em Pernambuco é basicamente de articulação e conseguir conectar os esforços que já estão sendo feitos. Importante também notar que no estado de Pernambuco já existe uma política de atenção integral para criança e adolescente com câncer, e isso é muito importante porque nos traz também esteios institucionais para a nossa iniciativa, e essa política ela olha para a formação, olha para a regulação e olha também para a necessidade de se implementar uma linha de cuidado específica para acompanhamento dessas crianças e adolescentes. Esse é um número, né, de crianças e adolescentes em potencial que podem ser beneficiadas com essa iniciativa, que a gente desenhou uma implementação em 4 anos. Então, é importante também notar que o Desiderata, nós somos um instituto que investe recursos diretamente, mas também captamos recursos para desenvolvimento dos projetos. Então, nós contamos com o apoio de alguns financiadores, o My Child Matters, o Jude, a Drogazil, e nós já conseguimos, com esses financiadores, já completar todos os recursos para os próximos anos. Isso é muito importante porque é muito arriscado começar um projeto de tecnologia social e precisar se pausar no meio, né? Porque a gente perde muito em termos de mobilização de território. Essa é uma foto emblemática que a gente tirou há um ano atrás, então foi quando nós lançamos essa iniciativa e para mostrar que é realmente um esforço de muitas e muitas pessoas envolvidas nessa agenda e é muito bonito olhar porque essa foto há um ano atrás nós éramos basicamente muitos desejos e muitas boas intenções, mas agora nós já estamos num outro lugar. Um ano se passou e a gente já fez muita coisa. Hoje nós somos um comitê que reúne 13 organizações, então nós temos um comitê estratégico, que é uma governança coletiva, então as organizações têm representação nessa mesa de governança e nós tratamos dos assuntos, das orientações e de todas as estratégias, são discutidas de forma coletiva. Essa é a nossa timeline de uma forma bem resumida, mas, assim, basicamente, o ano passado nós trabalhamos na articulação e na mobilização de todos os atores. Esse ano já estamos implementando o fluxo e a capacitação na GERES 1. A GERES é a gerência regional, então, Pernambuco é um estado que se divide em 12 gerências regionais, e a nossa atuação ela está planejada para começarmos a implementação da GERES 1, a gerência regional 1, que é a gerência maior, a maior gerência, que ela consegue congregar 20 municípios, e depois nós vamos expandir para as demais GERES e consolidar a iniciativa em 2026. É importante dizer que essa iniciativa combina 3 estratégias, né? São 3 eixos de atuação. Uma é a educação, que é a formação dos profissionais. Então, basicamente, a gente forma permanentemente esses profissionais para eles aprenderem a desconfiar do câncer, né? Porque, como é uma doença rara, muitas vezes eles não sabem fazer o diagnóstico. Então, basicamente, a gente ensina a mantê-los o alerta ligado. A informação, porque a gente precisa monitorar se esse encaminhamento está sendo correto, e o fluxo, né, de encaminhamento, que uma vez que você tenha suspeita, é importante saber o que você tem que fazer, quais são as diretrizes clínicas e onde se fazer, porque a ideia do Unidos pela Cura é não perder tempo. Essas são as metas são ousadas, são corajosas, mas é importante a gente se desafiar e a gente está mantendo os 3 dias, né, de alcance. Estou terminando e a gente tem algumas expectativas. Então, a gente vai formar mais de 2.000 profissionais de saúde nos próximos anos. Vamos ter um termo de compromisso, porque é importante a gente ter os acordos institucionais envolvidos para manter a sustentabilidade dessa iniciativa. Fazer uma pesquisa qualitativa e uma quantitativa para monitorar e avaliar essa iniciativa e fazer a implementação do fluxo. Antes de terminar, só queria falar que o tempo é a chave, tem cura e cada vida importa. Obrigada.
Obrigado. Muchas gracias, Renata, por tu charla. Creo que
Thank you so much,
yo creo
Renata,
que
for your
takeaways de
presentation.
esto es al ver
Uh,
la cantidad
the
de
lessons learned from
enfermedades
this
que
is to
hay
see the number of
en
diseases
Brasil
that we
en
have in
referencia a
Brazil.
toda la región,
In reference
suma
to
la
the entire
importancia
region, this sums
de
up
recalcar los
the
esfuerzos que se tienen
importance
que
to
hacer
underline the
y que
efforts
se
that need
alinea
to be
mucho
made
también
and that are
a
closely
las
aligned
estrategias que nuestro
to the
director está haciendo
strategies
sobre
that
la
our director has
importancia
formulated about the importance of having these approaches through the primary healthcare system and to see how many millions of children can benefit from this initiative. We know that this will have a wide-ranging impact, not only for the country, but we hope that for the region, we will always benefit from seeing successful models of cooperation. Thank you for your intervention today. Now we will continue with the panel on. There's no sound. Mute. Your microphone is on mute. You went back to mute. I apologize. I apologize for the technical problem. We will continue with the panels in comprehensive management and monitoring of childhood cancer with our colleagues from South American companies. We'll start with Dr. Florencia Moreno from Argentina.
Hola, buenos días, buenas
Hi,
tardes.
good morning, good afternoon, everybody.
Bueno, yo primero me gustaría
First of
agradecer
all,
a
I
la
would like to
iniciativa,
thank
increíble
the
trabajo. Me gustaría
initiative, the incredible work
agradecer a
performed.
Mauricio,
Thanks
a
Mauricio,
Patricia,
Patricia,
al doctor Sebastián Laspiura, a la
Dr.
doctora
Sebastián
Liliana
Lapura,
Vázquez, a
Dr. Liliana
SOA,
Vázquez,
Fuentes. Y
SOA,
quiero agradecer a Verónica
Fuentes,
Pelle
and
y al
Veronica
equipo entero
Peche,
del Instituto
and the
Nacional del
entire
Cáncer por el
Institute
gran compromiso
of Cancer
incondicional para los
staff
avances que se
for
están
their
haciendo en
commitment for the
oncopediatría
advances
en
that we are
Argentina.
doing in
Así que antes de
oncopediatrics in
empezar,
Argentina. So
quería
before
agradecer
starting my
muy
presentation, I would like to
sinceramente a todo el
express my
equipo que
sincere
está
appreciation to
de
the
acá
entire
y de la
team
iniciativa de todos
here
lados
and working on
antes
the
de empezar la
initiative
charla.
everywhere
Así
before
que,
starting my presentation.
bueno, la idea un poquito
So the
es,
idea,
bueno, largamos con la primera.
okay, we go with the first one.
Bueno, esta es, siempre me gusta
I
iniciar con
always
esta,
like
porque
to
esta un
begin
poco
with this
muestra
slide
la línea del
because
tiempo
this
y cómo la
shows the
incorporación de
timeline,
distintos
how
actores es clave
different
en el armado
actors have been
del cuidado
incorporated
integral del paciente oncopediátrico.
for the
Nosotros en el 1999
comprehensive
empezamos con el ROA,
care
con el
of
registro
oncopediatric
oncopediátrico,
patients.
y
So
en
we
el
started in
2010 se crea el
1999
Instituto
and then
Nacional del
with the
Cáncer.
registry.
Este
And then in
en este
2010, we
Instituto
started with
Nacional
the
del
National
Cáncer se
Cancer
crea un
Institute.
capítulo
And
pediátrico.
that was
En el
a program that
2016
had
se
a
crea
pediatric
el
chapter. In
programa de
2016,
oncopediatría.
we
Entonces, y acá
created the
ya es importante
oncopediatrics
mencionar que hay un
program.
programa y que
And
dentro
it
de
is
un programa
important
hay
to say
líneas de
that we
acción,
have
la
this
línea de
program with
registro, la
lines of
línea
actions
de
inside.
la red de oncopediatría,
Registration, the
la línea de
network for
capacitación, de
oncopediatrics,
etiqueta de
training,
calidad, de estrategias de diagnóstico
quality
oportuno,
care,
de
timely
estandarización de las
diagnosis,
prácticas y promover la
strategies,
investigación.
practices, and
Todas
promotion of
estas
research.
líneas que son
So all of these
primordiales
lines
dentro
that
del
are
programa se hicieron
essential
dentro
for the
del Instituto
program
Nacional del
were
Cáncer.
part
Y
of the
después, en
National
el
Cancer Institute. And then
2022
in
se promulga la ley de
2022,
oncopediatría y en
we
febrero se reglamenta, lo
passed
cual
the
le da
law
un marco
of
legal a todo este
care
programa
or
y estas líneas
oncopediatric
de
cancer.
trabajo
And
que
so this gave
veníamos
life to all of
avanzando.
these lines of work that we have been
Continuamos.
implementing.
Entonces, y esto lo quiero dar
So
dentro del marco, lo que
this
vamos a seguir
is within
hablando,
the
porque dentro de la ley
framework of
al
our talk,
contemplarse
because
las
within
distintas
this
líneas del cuidado integral
passing
del
of this
paciente, nos da un
law
marco
for
legal
the
para poder
comprehensive
avanzar
care of
en
the
estas
patient, we
líneas.
have a
Entonces,
comprehensive
acá repito un poco lo
framework.
mismo, julio del
So
2022
here
se
we
promulga
have in
la ley y se
2022, we
reglamenta en
passed the
febrero.
law, and
Pero
then
esto
it
viene
was put into
trabajando desde el
practice in
programa desde
2023.
muchos años
But then
más atrás.
for
La que
many years
sigue.
before, we have been working to this end.
Y acá, por ejemplo, en
So
el
here,
artículo 3 de la ley dice cumplir
Article
con el
3
registro
says we have
oncopediátrico
to
hospitalario
comply
argentino. Y acá voy a hablar
with
un
the
minuto de lo que es el
Argentinian
registro. Llevamos más de 40.000
Oncopediatric
pacientes
Hospital Registry,
registrados.
which
Tenemos
has
una tendencia de
40,000
incidencia
patients registered
estable, a
with a
diferencia de lo
stable
que se
incidence,
describe en
uh,
algunos países, en
different
lo
from
cual
what has been
dicen que la
described in
tendencia de
several
incidencia
countries. They say
pediátrica
many
aumenta. Nosotros en
times
Argentina
the
estamos estable.
incidence is
Tenemos una ficha
increased in many
única de
countries,
registro
but
que
we
está
have
online y que está
a
todo el sistema
level
informatizado. Y a la
increase. This is all
izquierda,
online,
una
it's all in
de
the
la charla
system.
con la que vamos
And
a
then
seguir
to the
hablando es
left, we
mostrar
have a
cómo
chart
en
that
cohortes
shows
quinquenales de
how in
supervivencia
different
populares se ve cómo
cohorts
aumentó
taken every 5 years, how did survival increase in Argentinian patients? So this is a cohort of patients that have survived pediatric childhood cancer. So all of these registers are published, the data are shared, and so we are finishing the publication for this year, and this will cover data from 2000 to 2022. Here we see what Article 3 says. It's just to help the oncological centers to continue to give quality care. This is just to show you that at the present time, we have 16,000 patients that have overcome the time of 5 years after diagnosis, and that we have more than 10,000 patients between 16 and 30 years of age. So with this is what I say, we have 16,000 plus patients alive. Many of them will have heart problems, so they could have approximately 250 patients would have heart problems. And then what is the type of treatment that these patients receive? These patients have an increased risk of having other tumors. 32 patients with retinoblastoma develop a second bone cancer or leukemia or other type of tumors. And then when they had leukemia, they had a second case of leukemia, lymphoma, or other tumors. And then this shows exactly here in the lower part, shows the part or the time at which the patient develops his or her secondary tumor. So secondary tumor possibility exists. So here we have developed this manual for the care and follow-up of children and adolescents after the oncological treatment. And I would like to thank PAHO especially for its collaboration in the development of this material and the wonderful work by Dr. Lydia Franchelli and for publishing this manual. Why do we have this manual? First of all, we had a great improvement in survival, and so the population that survived cancer increased. But then what are the complications in the long term? We know that these are critical and chronic conditions. More than 70% of survivors at some point in time have a chronic condition. And then the persistence of all the challenges is that toxicity has diminished, but continues to exist. We have a reduction of morbid mortality of the patients. We still have this. So what are the objectives? We have to have the timely detection of complications, of long-term complications. And this is a challenge both for all kinds of professionals and also for specialists. We have to take into consideration that these patients could have a second tumor. Maybe they would have a relapse of the original disease. Once they have they go over that possibility of relapse, then we have to have the aftermath of the treatment. Study that. General concepts, complications, the burden of chronic disease, the importance of early diagnosis, and then high premature mortality in these patients. Next one, please. This is the way we have organized the manual. And here we have each pathology described. In manuals for post-treatment information, we concentrate on drugs. But then maybe that there's not enough knowledge about the drug. So when you organize things by pathology, it is easy to see the link. In the last chapter, we will explain drugs, and here we have our thanks to Dr. PAHO and Dr. Lidia Fratelli, and to all the authors that participated in the preparation of this manual.
Vamos a ir redondeando. Ahí está un esquema general de los
Let
capítulos,
us
introducción,
one, we can see how the chapters are organized. Introduction.
Esto es un poco la descripción del manual,
This
la que
is
sigue.
a description of the manual. Next.
Este también sigue mostrando cómo está
This is
organizado
still showing
el
you
manual, la
how
que
the manual
sigue.
is formatted,
Creo que
how
tengo que
it's
ir
organized.
terminando para que me
Next, and I
termine el
think I'm running
tiempo.
out of time.
A
I'm
ver,
sorry, I
¿dónde estoy?
didn't
Tengo por ahí un
realize
ratito más.
I didn't have much time left. I just have a few
Y las
minutes.
recomendaciones generales
And then we
están en
have
el
general
manual. La que
recommendations
sigue.
also in the manual. Next.
Después, las recomendaciones generales,
So
que
these
tienen
are
que ver con la
general
prevención del cáncer
recommendations
secundario,
which have to do
gestionar los
with
riesgos
preventing secondary cancers and also managing
mantener un peso
cardiovascular
saludable,
risks,
reducir
maintaining a
grasas y
healthy
hacer
weight,
ejercicio
not smoking,
regularmente, la que
exercising regularly, and low-fat diets.
Y acá
Next,
quiero 2 minutos contarles
I'd like to
un
take 2
proyecto que
minutes
venimos
to tell you
trabajando hace
about a
años, que se
project
llama
we've
en
been working on
Argentina,
4
que se llama Prueba
years. This is
Post-Tratamiento
in Argentina,
ProCuido.
and it's
La
called ProCuido
justificación tiene que ver con todo lo que
Post-Treatment
explicamos
Care.
recién con el
And the
manual, no voy a
reason for this
detenerme,
is
la
what
que
I said
sigue.
about the manual, so I won't go into
Pero
it again.
lo que estamos trabajando para hacer
What
el ProCuido
we
es que
are
dentro del
doing with
sistema de
ProCuido
ROA
is that in the
pueda
ROA
identificar el
system,
paciente
we
qué tratamiento o protocolo está
identify the
recibiendo
patient, the
en caso de
protocol
que
or
no esté haciendo un
treatment he or
protocolo
she is
puntual, qué
receiving,
drogas y qué
also the drugs,
radioterapia va a
if there's
recibir
no
según los
protocol, and
campos
also what
que estén indicados.
radiotherapy
La que sigue,
the
con esa
patient is going to receive
información por un
as
algoritmo se fija
prescribed.
cuáles son los
Then an
efectos adversos. La que
algorithm
sigue.
identifies the adverse effects.
Entonces, en el sistema uno va a poder entrar en el
So
ProCuido y va a tener
in the
información
system, you
para
go
el
into
médico
ProCuido and you
para
get
el
information
paciente.
for
La que sigue.
physicians and for patients. Next.
Y para el médico va a tener los
The
controles que se deben
physician
realizar y
will
la
find the
frecuencia, los
controls
avisos que le va a
to be
aparecer al
performed, the
médico, los
frequency,
efectos
also
adversos, y al
the
paciente le va a
notices,
llegar
adverse events,
cuáles
and the
serían los
patient
cuidados
is
que
going to
debería
receive
recibir. Por ejemplo, este
information
es
about the
un
care he or she
protocolo
should be
de
receiving.
la LIC del BFM bajo riesgo y van a
So
salir
this
los
is a low
cuidados que va a
risk La
necesitar
Ligue
ese paciente reciba. La
protocol
que
which
sigue.
specifies the treatment the patient
Y la
would be
idea es que todo
receiving.
esto le llegue al
And the idea is
paciente
for the patient
vía
to have
una
access to
aplicación
all of
online
this
donde le diga
via an online
y que
app
quede documentado qué patología tuvo,
where
qué tratamiento
the
recibió
following are
y cuáles
documented:
son los
the
cuidados que debe
pathology, the
recibir
treatment,
de
and
ahí
the
para
follow-up
adelante.
care
La que sigue, y
to be
creo que ya
received
estamos
as well.
terminando.
The next one, and I think we're
Agradecer la
almost at the
iniciativa.
end.
Nosotros desde el 2022 que estamos
Since
vinculados, estamos desde mucho
2022,
antes con cada uno de
we
todos
have
ustedes,
been
pero
working together.
formalmente desde el
We've worked
año
with you individually
2022.
since
La
before
que
that,
sigue.
but formally we've been
Y un
a part
poco
of
a
this
seguir
effort since
trabajando todos juntos
2022.
y aprendiendo
And
cada
we
uno desde
encourage
sus
everybody to
regiones y
keep
dando lo
working
mejor que
together,
puedan cada
learning
uno y
in our
compartir las
regions and
vivencias y las
sharing
experiencias,
our
lo que el
experiences
cuidado del paciente
and
oncológico está
lessons.
representado en
I
esta
think
pirámide
that
humana
this
y
human
nosotros entre
pyramid
todos
represents the
abrazados somos
care to be
parte de
given
esta
patient,
pirámide
cancer
humana.
patients, and I
Así que
think
y
that
arriba
all
de
of us
todo
are
está nunca
represented
perder el
in
norte, que
that
es nuestros
pyramid, and we should
pacientes,
never lose
nuestros
sight
pacientes con cáncer.
of what
La
is
que
most
sigue,
important for
y
us is
esto
our cancer
es la última
patients.
porque no tengo
And this is the last
manera de
one
nombrar a
because
todos
I
los
have
equipos
no
humanos que hay
way to
trabajando en
mention all
Argentina,
the
de norte a
members of
sur,
the
de este
team
a oeste,
working in
pero esta es
Argentina
toda la
from
primera
north
vez que
to
cada
south.
oncólogo de
This is
distintos
the
lugares
first
del país
time that
vio el primer
oncologists from all
certificado
over the
oncopediátrico que
countries
se dio en Argentina.
received
Así
the
que muchas
certificate we
gracias
awarded for the first
y
time
bueno,
in
justo
Argentina
llegamos
in
corriendo. Bueno,
pediatric
muchísimas
oncology.
gracias.
So I think that we had to rush, but I think we covered everything. Thank you very much. Thank you for your presentation and for telling us that it's important for countries to understand that these things do not happen overnight. These processes take time, they take years, and we have to grow. So the initiative, I think, has helped us moved more quickly to take these steps. So it's important to look back at our journey. And I think this is an excellent example for other countries just embarking on that journey. Hopefully, we'll be able to do things more swiftly in countries that need this type of approach. So thank you very much, Doctor, for your presentation. today. Now we go on with Dr. Julia Palma, who is an advisor to the Minister of Health of the National Cancer Agency in Chile. Thank you very much, Mauricio, and thank you to the organizers for inviting me. It is truly an honor to be here with you representing Chile. This is a guide for solid tumors and leukemia. I'd like to begin by extending special greetings from Dr. Jimena Aguilera, our Minister of Health, who asked me to do this at this important meeting on Gold September. We represent a country of 19 million with 530 new cases of cancer per year. And we fortunately have been able to establish legislation on cancer, one that explicitly guarantees the right to treatment for children from the ages of 0 to 14 years, which was followed by a cancer law, which we have shared before. In the past, it only had a few paragraphs on children and adolescents. That was the first version, but now in the updated version, there's a national plan for children and adolescents with cancer that is currently active and which is part of the action plan for children and adolescents in Chile, and which you can access with the QR code you see on the screen. So that is the backdrop. Those are the cancer laws in the country, which have articles referred to cancer in children and adolescents, and also have a specific plan and clinical guides, and that is in Article 7. Next slide, please. The law relates to the clinical guides and states that the Ministry of Health must approve a resolution with the clinical guidelines for the treatment of different cancers and associated pathologies, including complications and long-term treatment. These guides must be revised every 2 years, and they must be updated with the most recent information and evidence available. And this is linked to a regulation which explains why these clinical guides should be in effect and should be applied in decision-making. So all of this is interconnected. In the next slide, you will see that Chile, through its national cancer law, has a definition for clinical practice and has a regulation that states that they're effective for decision-making purposes at the national level. Next. So according to this article, we know that the Ministry of Health states that the clinical practice guides are documents which have explicit information and recommendations to guide professionals and healthcare teams for cases that are suspected or have been diagnosed, and also for clinical practice and treatment, so that we can have a holistic approach which includes prevention, screening, diagnosis, treatment, rehabilitation, and palliative care. So this is how the National Cancer Plan is framed and how it is linked to the clinical practice guides. The objective is to develop the action plan in the coming years by 2028, and it refers to treatment protocols, specifying that under Pillar R, according to the structure of our plan, we have clinical practice guides and protocols. We have updated proposals for health approaches, and we have the new TSs. Next. Here you can see the clinical practice guides which provide the evidence as a basis for decision-making. Since 2017, Chile has been using evidence for decision-making purposes. And this is done according to the GRADE methodology. So the questions to be answered are not unlimited. These are questions that have to be answered by a team trained in the methodology. And this is linked to a clinical protocol. which supplements the clinical practice guide. Here, what you have is pillar R. We have the clinical practice guides using the grade methodology. These are developed by the Division of Healthcare Planning of the Ministry of Health. In the red, you can see the countries which use this methodology. It's very important for the group, which includes a methods team and also decision makers and citizens teams, including civil society and clinical experts and experts from the ministry and from the public healthcare system in Chile and the private healthcare Chile. So all professional sectors are well represented. So the methodology takes about a year, and there's a process whereby the problem is selected. It takes time to set up the group because it has to be multidisciplinary. Then we gather evidence. This is done at the level of the Ministry of Health. Then recommendations are formulated by the group. Then the ministry takes a few months to approve publication, and after that we have publication and dissemination. So this is what we are able to proudly showcase today. It is a joint effort. We have worked with the rest of the region. So these are practical clinical practice guides for leukemia in children under 15, as well as the guide for solid tumors in children under the age of 15 as well. Under pillar R, we have the clinical practice guides, and there is the proposal to update healthcare packages. This includes the prioritized delivery. This includes explicit guarantee and also covers new health technologies. Chile has made great progress in a short time. It has been able to include these new healthcare technologies that are listed here for patients with leukemia, with high risk, and also for patients who have a relapse of leukemia. So this is something we were able to do just recently last month. I'd like to end my presentation by extending special thanks to the group that developed these clinical practice guides and all the others I mentioned, the Ministry of Health, ITESA, and also those who were members of the group that prepared this presentation, Orieta Candia, Tamara Salgado, and Carolina Robledo. Thank you very much. Thank you very much for your presentation and for sharing with us information about the process you've gone through. As we have said before, Chile is a very good model for the region, and not just in the case of pediatric cancer, but also in the treatment of other cancers as well. Your progress and your development of guides, which other countries are going to have to develop as they begin their transition, as they seek to provide or to ensure access to drugs as part of the platform, will have to follow. So with that, we give the floor to Dr. Lisette Marmol, who will also be speaking about Ecuador's experience, since Ecuador is the first country that will benefit from the use of the global platform for access to drugs for pediatric or childhood cancer. Thank you very much, Mauricio. I just want to confirm that you can hear me well. Okay, well, I've turned on my camera as well. Good morning. It's still morning in my country. I'm Dr. Lisette Marmol Egas. I'm a pediatric oncologist, and I work with the Ministry of Public Health in Ecuador. Today, I'll be speaking about our country's experience. Just a minute. Our country's experience, as I was saying. I'm sorry, I opened the wrong tab.
en la experiencia del país acerca de
So
la
our country's
implementación
experience
de
with the
la plataforma global
implementation
de acceso a
of the
medicamentos contra el
global
cáncer infantil,
platform
conocido
for
por sus siglas como
access to
GPACCM.
medication
Y
for
en esta primera
childhood
diapositiva,
cancer, known by
la
its
intención es poderles
initials
expresar o explicar una
GPACCM.
línea de tiempo
So the
de
idea
cuándo
is to
inició el
use a
programa.
timeline to
En
show
febrero del
you how
2023,
things
Ecuador fue seleccionado
were done.
como
In
el
February
único país de las regiones de
2023, Ecuador was
América
selected as the
para
only
integrar
country from the
esta fase
Americas
piloto.
to
Y
join this
finalmente, en
pilot
abril del
phase. And in
2023,
April
se lanza el
2023,
GPACCM
the
en
GPACCM
Memphis,
was
Tennessee,
launched in
y
Memphis,
conocemos el nombre de los
Tennessee.
otros 5
And we
países que
learned the
también
names
iban
of
a
the other
formar
5
parte de
countries that
nosotros,
were also going to
junto con
be
nosotros para la
joining
implementación
us in the
de esa fase piloto.
implementation of that
Una
pilot
vez que supimos
phase.
de qué se trataba, que
Once we
habían
learned what
35
this was
medicamentos
about,
que van a
that there
estar
were 35
destinados
drugs
para
that would be
chicos,
used for
niños, niñas y adolescentes
children,
con cáncer
boys,
que
girls,
estén
and
en
adolescents
territorio
with
nacional,
cancers on our national
claramente es
territory,
una estrategia, es un
this
proyecto que no puede
strategy and
ser
this
de un
project
solo polo ni de un
clearly could not
solo
be
líder,
carried
de una
out
sola
by
arista. Tenemos que
one
invitar a todos
single
los actores
unit
relacionados
or
y
in
es
one
por eso
single
que se
way. We
realizó la
had to
primera
bring all
socialización en julio del
different players in
2023,
on
contando
board.
con la
That's why in
participación de
July
servicios públicos de
2023, we
salud, de
began
servicios
sharing
privados de
this
salud, la
with
sociedad
social
civil y la
services,
academia.
with
Era
healthcare services,
prioritario
with
poder
public and
levantar un
private,
análisis
civil
situacional que
society,
nos
and
permitiera identificar
academia.
nudos
We
críticos y
needed to have
establecer
a
mejores
status
conductas
analysis to
en
identify
cuanto a cómo
critical
vamos
nodes
a
and
mejorar esto
opportunities,
y encontrar esas áreas de
and to
oportunidad.
find
Y era
those
muy
areas of
importante
opportunities that would be
contar con un
critical. It
grupo
was
gestor
important for
desde
us
el
to have a group
Ministerio de Salud Pública
in the
que
Ministry of
pueda
Public Health
liderar y coordinar
managing and
todas las
coordinating
acciones
this initiative
necesarias
and all the
para que estos
actions
medicamentos sean
required
una realidad en
for
el
these
país.
drugs
Y
to be
así es
available in the
como de agosto
country.
a diciembre
And
del
that is how from
2023
August to December
estuvimos
2023,
seleccionando de
we
manera
worked
conjunta con OPS
on the selection jointly with
Princeton
PAHO
y St. Jude.
of
¿Cuáles
and
iban
St.
a ser
Jude
las
of the
instituciones que
institutions
potencialmente podían
that would
participar de nuestra
potentially
estrategia? Y
participate
se
in the
seleccionaron 13
strategy.
hospitales,
And
de
we
los cuales
selected
5
13
pertenecen
hospitals, of
al
which
Ministerio de Salud
5
Pública y
are
7
under the
pertenecen a
Ministry
la
of
red
Public
privada,
Health and
conocidos
7 are
en su
private.
localidad como los SOLCAS, ¿no? Se hicieron estas autoevaluaciones para
We
poder mapear que
performed
las instalaciones sean las
self-evaluations
adecuadas
to
para este
determine
proyecto.
that they had the
Y luego
required
vinieron las
facilities.
visitas
And
presenciales.
then
Entonces, en
we
estas
did
fotos,
on-site
ustedes pueden
visits.
ver la primera reunión
What
que
you can
tuvimos de
see
socialización
in
en
the
el
photos
país
is the first
y las
meeting we
visitas
had
de
in the
instalación a las
country,
bodegas de los hospitales.
the meet and greet, and
Siguiente,
then
por
we
favor.
have the on-site visits to the hospitals. Next.
Y era importante que todas las
And it was
actividades
important for
derivadas de
us
todo
to
este
make
gran
sure that
trabajo
all
que
the
había y que
activities that
hay
were
todavía
going
por
to be a
delante
part of
sea
this
agrupado por
effort
categorías que
were
nosotros llamamos
grouped by
categorías de trabajo,
categories,
o
which we
perdón,
call
pilares de
work
trabajo.
categories,
Entonces,
or rather work
estos pilares de
pillars.
trabajo son la
So
gobernanza,
these
la cadena de
pillars are
suministro, nuestro
governance,
operador logístico y la gestión clínica.
supply
En estas dos
management
fotos podemos
chain,
ver a la
clinical
doctora Nidia
management,
Villacrés, que es
and
nuestra
logistics
consultora
operator. You can
nacional de
see
OPS y
Dr.
que ha
Nidia
sido un
Crest,
apoyo
who's our PAHO
invaluable para
consultant
todo
in
lo
the
que se ha
country. She
tenido que
has
levantar de manera
been
conjunta
invaluable
con el
in
MSP.
supporting
Y en
us
la foto
with
de
the
abajo es
MSP.
la reunión de
At the
julio del
bottom, you can
2023,
see the meeting
donde
in
hay
July
personas que
2023.
continuamos todavía en el proyecto y
Some of
otras
the
que han
people
sido
there are
llevadas
still
a otro
working on the
punto.
project, and others
Algunas
have
de
been
las
replaced
características que compartimos en nuestros
because
países
I think
es
that
la alta rotación de
one thing
funcionarios.
we
Sin
see in all
embargo,
our
creo que la
countries a high
clave
turnover
está
rate for
en que no importa si
professionals
cambia una
in this
figura
field,
o
but it
cambia
doesn't
una
matter if an
persona,
individual
siempre y
changes.
cuando esta persona se
What's
enamore del
important is
proyecto y
for that person
confíe
to
en
fall in
cuál
love
es
with
el
the
objetivo
project
común
and believe in
y
the common
podamos avanzar
goal
hacia la meta que
so that
tenemos
we can
trazada.
make progress towards our
Siguiente
established
diapositiva, por favor.
objectives. Next.
La idea no es mencionarles todas las
So I'm
actividades
not
de
going to
cada
go
uno de
over
los pilares de
every
trabajo,
single
sino
activity
mencionar
under the
solamente las que
work
son más
pillars. I'd
relevantes.
just like to
En la
highlight
parte
a
de
few.
gobernanza era
Under governance,
y sigue siendo pilar fundamental
this was
mantener
and still is
puntos focales.
key,
Puntos focales
and it's
en la
based on having
planta
focal
central del
points.
Ministerio de Salud Pública, un
Centrally,
mecanismo de
at the Ministry of
gobernanza que
Public
viene a ser
Health,
la
we have a
Comisión Nacional de
governance unit,
Cáncer,
which is the
la
National Committee
designación
on
de
Cancer.
responsables
Then
fijos
we
en los
have
hospitales que participan de la estrategia y la firma de
identified
acuerdos legales. En la parte
responsible
de gestión
parties in
clínica
the
se tuvo que
hospitals,
levantar un
that
análisis
under the
funcional para
clinical
identificar
management,
los
we had to
protocolos
do
terapéuticos que
an
se utilizan
analysis to
dentro
identify
del
the
país
protocols
poder
in use
identificar
in the
cuáles eran
country
los nudos
for
críticos
development, also identify the critical points in the hospital facilities participating to find a way to address any shortcomings or needs. Then on the supply management, we had a focal point in the National Office for Supplies and for regulating drugs to orient us on the national procedures to regulate these essential drugs and also to look at the development of drugs based on the morbidity model. It was also important to see how we would receive these drugs, how we would monitor the use of the drugs in children, and also how we would store the drugs and the distribution plan. So we decided we needed to have a logistics operator. Next, for 2024, we developed activities per trimester. By March 2024, we had completed the evaluation and improvements up to 96% of the hospitals participating in this first phase of implementing the GPA-CCM in the country. And why a first phase? Because we are considering an implementation plan that it has two phases. The first is hospitals and Ministry of Public Health, and the second is private hospitals, known as OICAs. For the first phase, we've already completed the evaluation of minimum criteria, and we do have regular meetings with the hospital representatives. Between April and June 2024, we signed letters of agreement establishing a period for the implementation of the plan for GPA-CCM. We completed the estimation of medications based on the morbidity method, and we implemented the National Commission for Child and Adolescent Cancer in July. And finally, this is our governance mechanism. And finally, between July and September, we will be hiring the logistics operator. And we have also been working with the Epidemiological Surveillance and Statistics Unit to develop a registry of hospital data. And we're also working on developing an agreement for the donating of drugs to the SOLCAs, which are the hospitals in phase 2. What we hope to do from October to December is to update the regulatory standards for supply management. We are already developing the information sheets for the training of personnel involved in chemotherapy, and this will be boosted by a virtual course, which will be on our virtual campus. And we also hope to be receiving the equipment needed to maintain the supply chain for donated drugs. Next, and what is a milestone? A milestone is something that marks a key moment in the context of a strategy in a country and a timeline. You can read everything on this slide, but what I would like to highlight is actually three things. Ecuador was able to establish a governance mechanism through the Management Committee and the National Commission on Cancer for Children and Adolescents, which is currently working on what's going to be the policies for the management and maintaining of the strategy. Thanks to this, we have achieved 96% progress in the evaluations of minimum criteria required for the delivery of the drugs. What are minimum criteria, you may ask? There are 39 items in 16 categories, which are the essential drugs needed to treat a child with cancer. And we've completed our estimation of the drugs needed for hospitals in the first implementation phase. Here you can see the letters of agreement signed, the short, medium, and long-term objectives. And also you see a time graph showing the progress made and the drugs based on the morbidity model. Next, so what are the next steps? What do we expect to do in 2024 and 2025? For 2024-25, we're not just waiting. We have already begun to work. We've requested the SOLCA hospitals to start to prepare an inventory of their needs based on the morbidity method. And with the ministry, we're working on clinical policies to organize oncology services, to have referral networks that are optimized, also to have a steady supply of medication, and also have storage and distribution facilities. Next. So this slide is my last one, and what I'd like to share with you is what we have learned up to now. We have learned that the challenges we face in treating children and adolescents with cancer can become opportunities to strengthen the healthcare system of a country. One example in Ecuador is that we're working on developing information systems, optimizing the referral and service organization system, also training for healthcare personnel, and developing national policies and clinical practice guides for cancer in children. And governance is the key to catalyze changes in healthcare systems. However, the commitment of the participating parties is fundamental because our national context is complex, because we have fragmented healthcare systems. Therefore, it is essential to have multi-sectoral participation to achieve a common objective. And the common objective is this little boy. He was able to receive treatment, and God willing, will be part of the 60% survival rate we hope to achieve by 2030 with this platform, which provides access to childhood cancer treatment drugs. Thank you very much, Doctor, for your presentation and for sharing with us what is an example for all of us to follow, showing us what happens when the Ministry of Health takes the lead and prioritizes childhood cancer, how governance can be enhanced, and how key players and decision makers can be brought on board to ensure that it is possible to take actions at different levels and phases to provide access to pediatric treatment drugs. Our last presentation today is by Dr. Catherine Lamb, who directs the St. Jude's Children's Research Hospital Research Unit. She will speak about integrating services for boys, girls, and adolescents in the national fight against cancer. Thank you very much. It's a great pleasure to be with you at this meeting on childhood cancer. I'm very happy to speak about our National Cancer Control Planning Program and integrating children, adolescents, and young adults in teams that we have set up with the ministry. Our interest in national planning has been growing for a number of reasons. But planning and developing a national plan can sometimes seem to be a black box. It's very different from working with a manuscript. So how do we ensure that we go from words to actions, and how do we energize others to join us in this process? One of our main mandates as a collaborating center on childhood cancer for PAHO WHO is to support national planning efforts. So what we have here is one of 10 Cure-All Central projects. Our program in CCP ICAIA is based on our set of tools for national policies aligned with the Sustainable Development Objectives. And also, it works with thousands of national policies that are already in place. We provide the national teams with support that is essential because many national programs lack policies or budgets that include children. Our program is aimed at prioritizing children and also strengthening collaboration. We have seen a sustained and growing interest in recent years. For the first time, we also have mentor teams. We now have a structure for routine dialogue and to exchange views as well as evidence to address policy challenges we find in the real world. We are changing the way teams approach the work they do together. As you can see, we have country teams in all of these countries, and they work at different levels in the global initiative. This includes the cohort from last year. 8 of the 29 countries are from this region. And now it's a pleasure for me to turn over the floor to 2 of the national teams in NCCP ICAIA. First, the leader of the mentors team from Peru, Manati Diege, and then the NCCP ICAIA team from Honduras. Essie, you have the floor.
Essie me escribió que está con un poco de problemas. No sé si podemos pasar a Ligia y regresamos. Ella está conectando su audio.
I don't know if we can go back to Ligia and come back because we have problems here.
Muy buenos días. Muchísimas gracias, Catherine, y a todo el equipo.
Thank you so much, Catherine, and all the team for the possibility of sharing with you the great experience that we have had as a multidisciplinary group in different organizations, working with the Secretariat of Health, the local secretariats, and also the groups for cancer treatment in children in our country. And we are part of this great initiative and are grateful to be able to work together to strengthen governance in childhood cancer in our countries. Thanks to these activities that we had the opportunity to collaborate with different professionals from the health system, the National Organization for Children with Cancer, our own multidisciplinary group, and we were able to work with them, and through PAHO's help, we were able to start the development of a national childhood cancer control plan in Honduras. We are centering on childhood cancer, but through the Health Secretariat, we also plan to have this a general cancer control plan for the entire population. We are right now working on the rules and policies for this plan. We were able to have a draft of a bill at the political level on this matter. And this creates a lot of interest at the national level. At the present time, the Health Secretariat, through different groups in charge of the National Cancer Registry, are strengthening this work with support from the national and international entities. This is a great source of motivation for all of us because it's an activity that is permanent in nature with the support of the Honduran Foundation for Childhood Cancer, and also we have workshops concentrating on childhood cancer and primary health care for this population. Through all of these activities, we have worked together with the government, with the communities, and we have been able to access children with cancer, even though our country is small, but our country has a lot of problems with access, and many patients belong to low-resource families. So at the national level, we were able to create an access network so that who cancer has the proper care. We have cancer diagnosis in different pediatric hospitals in the country. In Tegucigalpa, the capital of the country, and also in San Pedro Sula and other cities close to the jungle. We have been able to work with this initiative, and this is an opportunity which is wide-ranging in nature, because here all the stakeholders join together to fight childhood cancer with a lot of motivation to be able to improve the percentage of survival and the rates of survival. We are working with cancer treatment plans with the advice of international consultants and specialists. And for 2030, we hope to be able to reach the goal of increasing survival rates in our children by 60%. Thank you so much for the opportunity you have given me to share the good news that have taken place in Honduras. Thank you so much, Ligia. Esi Maradiegue. Thank you so much for the opportunity. It is a pleasure to talk about our experience in Icaya, Peru. First of all, thanks to the participation of everyone, we have been able to draft a plan for cancer control in children and adolescents within a framework that has been discussed and that you know well. And when we are developing now the 2025-2030 plan, and very important and significant changes have been made at the level of the Ministry of Health, such as the development of a cancer control plan in children and adolescents. And I think that the lessons learned about living through this significant experience in my country have led to key points to the development of this plan. And this allows us to approach this in a comprehensive way. And this is very valuable because it gathers the experiences of different countries with similar experiences, and we serve as model to each other. And also, we thought that this sharing of information was essential for formulating the framework for our work. Thank you. That's all. Thank you so much. Now,
muchas gracias, Kat. Como comentamos, parte de la metodología de la serie es que los países traigan sus propios estudios de casos.
Before, it is important for the countries to have their own studies. So for each one of the pillars, we ask them to bring examples. How do you see these cases? So case studies are important. Lessons learned are important. We have primary health care. We have financial improvement. We have different treatments for different cases, information systems. And then for the facilitators, we have a role for civil society and many other instances. So what we wanted to do is to invite you, if you are interested in policies and systems, and if you are interested in solving the challenges for children and adolescents, please join us in next pause, which is called Nexus in Policies and Health Systems. And you can just go to this QR code, and there you will find all the information and topics of interest. We can explore the points for connections among policies and systems and main challenges. We also connect with other partners within and outside the communities of pediatric oncology. And so we have a joint set of ideas. We increase the capacity for collaboration in research and policies and health systems. We also facilitate the development and dissemination of instruments for the strengthening of systems. And then we contribute to several areas that are cross-cutting areas, such as essential diagnosis, access to drugs, and so forth. So we hope that you will participate in our discussions. We also have a second opportunity to meet you. We invite you to also fill this here the information in the QR code. And I hope that we can just have a picture for everybody to make sure that we join everyone from the collaborating centers and that we all participate in this conference to be held in 2024 in October about cancer control. Congratulations to all, and we invite you to join us in October 2024 for this meeting. I finish here. Thank you so much. It has been a privilege to work with this incredible team here at St. Jude and PAHO. And thank you so much, and good afternoon to all. Thank you so much, Catherine, to all the St. Jude team, our colleagues, for sharing you. I know that we have exceeded our time, but I also would like to give the floor to Paola Friedrich so that she gives us some closing remarks about today's activity, and then we would like to ask you to stay here and turn on your camera so that we can have a picture of your excellent participation. Thank you so much, Mauricio. It has been greetings to all. It has been a very interesting session. We have seen a general outlook of the context in which we are launching the Cure All Americas initiative, and to capture the different perspectives in a more concrete way, to know what's going on in different countries of the region. So, on my part, I know we have exceeded our time, and so for that reason, I'll be brief. And I just want to let you know that we are very excited about continue to support this initiative in the region, the topics, the goals, objectives, also in Jude Global, and the different cross-cutting topics that we have discussed with Jude and PAHO, and Cure All globally and in the Americas, and with all the organizations participate in hospitals. And additionally, I believe that we have discussed a little bit more extensively is the feeling of urgency that 2030 is just around the corner, and how we can begin to work in what has been a marvelous movement. Different parts that have been worked together, and everybody advancing in their own areas, in their own control areas and influence areas, and how we can take advantage in 2026 and from here to 2030, how we can work jointly with some areas being defined, and so that we can define our goals in a clearer way, and how we will be able to reach those goals. So these are my last words, and I just have a feeling of clarity and urgency. 2030, don't forget, is just around the corner, and we have the elements to reach the goal. And perhaps we have to orchestrate the way we're going to do this. Count on me, count on my support, and count on the support of the entire team at St. Jude. Thank you, and happiness to all of you. Thank you. Thanks to all the participants who have been with us with the past 2 hours. And also, I would like to ask everybody to please turn on your cameras to take a picture of all the participants in this meeting. Thank you so much to all the participants, to everybody who has asked questions through chat and questions and answered, everybody who has been interacting with the presenters, and we want to continue to support this initiative. There are many things that will come from this. Thank you.
Sonrisas, yo voy a sacar la foto.
Smiles, please. Smiles. Here, I'm going to take the picture.
Excelente. Muchas gracias.
Gracias.
Thank you. Excellent. Bye. Thank you. Have a nice weekend.
Un gran abrazo.
Thank you. Bye.
Estuvo genial, muchas gracias.
It was great. Thank you so much.
Gracias a ustedes.
Gracias, Mauricio.
Thank you, Mauricio.
Gracias, Liliana. Gracias,
Thank you.
Patricia.
Thank you, Patricia, Mauricio, everybody. Thank you.